So how is genicular artery embolization performed, or how does it even work, or the GAE procedure? So the answer is actually pretty simple. Let's talk about what's causing the pain in the knee in the first place. And usually the issue is inflammation. Any kind of pain has to have some kind of inflammation, especially if you have osteoarthritis, or even after a knee surgery, you have inflammation. Now, inflammation can only occur if you have blood flow to that area. The inflammation is what causes the pain, and if you can reduce the blood flow to that area, then you can actually reduce the inflammation and the pain can go away. Now, this is accomplished, and this procedure is accomplished by placing a very small little catheter, like a little tube, directly into these little tiny blood vessels. Now, I'm talking about blood vessels that are very, very small. They're almost microscopically small. And this is how you can do this procedure, eliminate these tiny little blood vessels and the blood flow without hurting any major other surrounding tissue. And this is done by starting a little IV, usually in the leg or in the lower foot or in the groin area, and then sliding a little catheter into the blood vessel and then finding our way into the little tiny blood vessels where the inflammation is. Once the little catheter is in place, then what happens is that we just inject these little tiny particles. They're like microscopic sized particles that are just small enough to reduce the inflammation and not cause harm to any other surrounding tissue. It's kind of a new technology performed by an interventional radiologist. Now, this type of procedures have been performed throughout the body by interventional radiologists for over 50 to 60 years. What's amazing now is that we figured out that we can actually use this procedure to control inflammation for knee pain. And there's so much research now that's out there that shows that this is an effective procedure, works well, technically pretty easy for an interventional radiologist to perform, whose entire subspecialty is dedicated to just this type of catheter work using X-ray guidance. The procedure usually takes 30 minutes to an hour, and again, it doesn't involve any incisions, just a needle puncture like an IV. It's usually done as an outpatient, and the patients just go home the same day. It doesn't even require general anesthesia. The risk of anesthesia is actually higher than the risk of the actual procedure, and so this is done with light sedation, kind of like what patients will get when they go for like a colonoscopy or something. So it's pretty well tolerated. In any event, if you want more information on how this procedure is performed, we'll be happy to talk to you. Just call our number or make an appointment to see one of our clinical specialists who can actually go through this entire procedure for you in a stepwise fashion. And remember, you always have to be your own advocate as a patient. Learn as much as you can when it comes to any type of treatment so that you are just better educated. Take care.